Well, long before COVID-19 came along, Oklahoma was dealing with a nursing shortage, and the problem has only been magnified by the pandemic. Our content partner, State Impact Oklahoma, has been doing some excellent reporting on this issue. Catherine Sweeney joins us with this ONR Extra.
Our nursing shortage started in about 2001 when George W. Bush was still president, and our state has been working on it since. But COVID-19 made the problem worse. When I interviewed OU Medicine, they said that there were times where they had 40 clinical staff out at a time because of community spread causing the need for a quarantine. So that was a big issue as well. And then, of course, there's been issues because when we stopped elective surgeries for a while, a lot of nurses got furloughed because the hospital couldn't afford to keep them on. So that's hampered supply too. And of course, there are the obvious issues. It increased demand for nurses. Some of our worst COVID patients required 1-to-1 ratios. Every patient needed its own nurse. Of course, the rest of the country is facing a COVID pandemic as well. They all needed nurses. So a lot of Oklahoma nurses went to Texas or New York or California or Washington, Oregon. They were all over the country. So on a national level, there are about 1,150 nurses for every 100,000 population. That's about average from state to state, but Oklahoma has 700 nurses for every 100,000 population. Three of the big causes for our nursing shortage are education, retention, and keeping people in state. A lot of people, once they get that nursing degree, leave Oklahoma. They go somewhere like Texas or California, where they might get paid better. They are in a bidding war. A lot of hospitals are trying to find a way out of that because it's just really complicated. Oklahoma struggles with a lot of healthcare funding. We have low Medicaid reimbursement rates. That means they're getting paid less for a certain operation for a Medicaid patient than a doctor or a hospital or somebody else would get paid for the same operation or procedure in another state. Oklahoma isn't really capable of competing in a bidding war the way that these big, Houston or Austin, these big metros can. And then you need to factor in that nursing is a physically and emotionally demanding job. The average nurse retires at 52 instead of well into their 60s or 70s because it breaks down your body. And so it's just a pretty nuanced and complicated problem.
And if you'd like to read Catherine's article in full, as well as other great content, go to stateimpact.npr.org/Oklahoma.